Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, dear viewers, ladies and gentlemen. Hello and welcome. Dr. Mohammed AlSheef, your host of Elixir of Life, kicking off another inspiring and informative episode about vitamin D deficiency with our distinguished guest, Dr. Naji Juhani, aiming to explore new frontiers and bring you most up-to-date information about or related to health. Remember, Elixir of Life, your best source of evidence-based medicine, and knowledge is the best prevention and the most powerful tool. Stay tuned for a special episode. Don't go away, stay with us. Once again, welcome back to Elixir of Life. Our next segment will be Quote of the Week. Stay with us, don't go away. Once again, welcome back to Elixir of Life. Our next segment will be medical news. We have today medical news about non-surgical transcatheter aortic valve implantation. See more details about this report. Stay with us. Don't go away.
Assalamu alaikum. My name is Dr. Naji, Head of Pediatric Cardiology and Adult Congenital Heart Disease Interventionist in Prince Sultan Cardiac Center.
Dr. Khalid, what could you tell me about this complicated surgery?
Yeah, so these usually cardiac catheterization are replacing an open heart surgery. So where we put pulmonary valve, previously like 5 to 7 years back, it was done through an open heart surgery. Now we could get the patient and put this valve through the catheter, so through a femoral or an opening in the left leg, and where you could deliver this valve in a short period of time, and the recovery, the stay in the hospital is very short compared to the open heart surgery.
Excellent. Doctor, how long does this surgery take?
Usually with the preparation, the patient will go to sleep. Till the end of the procedure, it's around 1.5 to 2 hours.
That's good. Finally, Doctor, how many operations you've done today?
Yeah, so today the plan is to do 2 cases as a live transmission to Miami, USA, as part of an interventional meeting. But in this center, it has been done more than 170 cases previously.
I am Dr. Tariq Momina, senior pediatric cardiologist, and I'm the assistant deputy of the program director, deputy of medical administration at the Prince Sultan Cardiac Center.
Dr. Tariq, can you tell me about this special surgeon?
Okay, this is actually, it's almost like surgery, is a transcatheter pulmonary valve insertion, which was done not opening the heart surgery. These patients had already 2 heart operations, bypass and change of conduit, and he stayed, one at 1 year of age and the other one at 7 years of age, and he stayed in, post-surgery need a lot of complications. So what we do a catheter diagnosis and go across the femoral vein and artery. We diagnose, the severe stenosis of the conduit. He was symptomatic. After that, we did an angioplasty, but because if you do an angioplasty, which is balloon dilatation of the conduit, there will be severe insufficiency, or the blood from the pulmonary artery will pass to the right ventricle, and this will cause more heart failure. So to help in that, we have used here transcatheter pulmonary valve insertion, which we have developed here in our hospital since 2007. We are the pioneer, and we are the first one we have done with this hospital in the Middle East, and even before many centers in Europe and Australia. And we have been successful in the program, and we have large number of cases, approaching about 200 cases. We have done this case with the biggest cardiac symposium intervention for adult with congenital heart disease and pediatric, and this is going across the United States, and they see what we are doing, and we transmit our experience, and we share also their opinion, but mainly to show that we are up to the knowledge and skill that we can be competitive with outside world.
Dr. Tariq, last question, how safe this operation is?
Okay, we have, well, it has to be done technically perfect, and somebody who's experienced and had a lot of experience in intervention. Usually the safety is very safe, is more, the success rate is more than 99%, and we haven't had any problems of like God forbid a patient died or something like this. That most of the patients usually discharged within 2-3 days from the hospital.
Take a wire and just flare those, distal end of the stent. This is an open stent, stent. It's an undermid, and you'll be able actually to flare it and have two hoses going to the left and the right.
Ja, genau.
And I think it's
die 1,
worth
stehen auf die 1.
instead of going through a cell.
Okay, verdichte auf den Tariq nur. Jetzt, come on. Philipp. Nein, André, die brauche ich total.
Well, I think it looks like the next narrowest area is the proximal conduit again, which extends in that graft in both of these projections, the areola and the lateral. So I'm wondering if a stent, a 40-10 stent or something from the outflow tract up into the next stent to stabilize it.
Once again, welcome back to Elixir of Life. The previous report highlighted the significant progress and advance of healthcare system in Saudi Arabia. Our next segment will be health myth and fact. To see more details on this report, stay with us. Don't go away. Once again, welcome back to Elixir of Life. Now we are coming to the most important segment of our episode. Now we are coming to talk about vitamin D deficiency. It's a common disease, and some health experts consider it the new epidemic, and vitamin D replacement is the new Elixir of Life. Without further ado, it's my immense pleasure and privilege to present my distinguished guest, Dr. Naji Juhani, consultant endocrinologist and thyroid oncology, assistant professor of endocrinology, and he's highly published of more than 70 papers in peer-reviewed local and international journals, and he is also influential media person and involved in many societies, and he's a chair of osteoporosis. Welcome, Dr. Naji.
Okay, thanks, Dr. Mohammed. I would like to thank you and thank Saudi Channel 2 for this invitation to be part in people education about vitamin D.
Excellent. Actually, it's our pleasure, and your expertise. With your expertise, we will raise the bar of this program. Let's start by what's vitamin D?
Yeah, initially vitamin D was labeled as vitamins. Vitamins as after vitamin A, B, C, then vitamin D in 1925 by Dr. McCallum and his colleague as anti-rickety factor at that time. But with more research for the last 3 decades, we noticed that most scientists, they change from vitamin to hormone. The reason for that, vitamin, it generally trace element, and it is not synthesized by our body, and we can get it from outside. But in the reverse, vitamin D can be gotten from outside, but it is mainly synthesized in our skin, then oxidated and hydroxylated in the liver as first hydroxylation, then the second hydroxylation in the kidney. And the second thing also, in all vitamins, we don't have any receptor in the cells at cellular level. In contrary, vitamin D have vitamin D VDR receptor, which is again, this is make this more as hormone. The third thing, the structure of this vitamin. The structure in general for vitamin D, it is almost what we call it steroid-like structure, and it's a powerful steroid structure-like effect. And all of these together make this more as a hormone rather than vitamin.
Excellent. That's very amazing indeed. So vitamin D is a hormone, not vitamin.
Not a true vitamin.
Yes. How much do I need from vitamin D?
Yeah, vitamin D depend for people like kids, men, women, adult, elderly. In general, people, they require from 600 to 2,000 international units daily. Now, if we go for infant, like less than 1 year old, they need like 400 international units daily. And from 1 year till 15 years of age, they need probably 600 international units daily. Above that, like for men and women, in adulthood, they require from 800 to 1,500 daily. In people who are elderly, like they require 1,500 till 2,000 international daily. Those with comorbid illness like osteoporosis, fragile patients, etc., usually they require more than 1,000 daily.
Excellent. In the past, they say 400, then they increase to 600. Now you are saying that it's variable dose, but from 800 to 1,500. What's the reason why they are keep increasing the requirement?
If we see, for example, in the past, people, they expose more to the sun and they get more vitamin D rich food. Nowadays, almost they get nothing. And now when we test vitamin D for people with symptomatic vitamin D deficiency, we find level up to 0, which means that those people, they don't expose at all to the sun for maybe weeks, months, probably years. And now people in general, we recommend them to get vitamin D from the sun. If you expose your just arms from like mid-arms, both hand and legs, probably 10-15 minutes in the midday from 9 till 3 o'clock at these days, and from the summer from 8 till 10 or 2 to 4. This will give you enough vitamin D. You don't need to take a supplement. But if you don't expose yourself to vitamin D, to sun exposure, or you don't take this food, and actually 90% from vitamin D came from the sun exposure, and less than 10% from food. And we have just limited sources of food that contain vitamin D.
Excellent. Dr. Naji, this leading us to the next question. What happens if I don't get enough vitamin D?
So people, if they don't get enough vitamin D and they don't expose, they will be prone to vitamin D deficiency. By definition, vitamin D deficiency, if it is less than 50 nanomole, which is in nanomole per liter, which is almost less than 20 nanogram per ml. If people are low or deficient, they will consequently prone to symptom of vitamin D deficiency, like muscle ache, bone ache, fragile fracture, osteomalacia, etc. They can also have hair fall, headache, chronic pain, etc. And they will be at risk also for weakness of the bone. If they are kids, they will be in softening of the bone, and will they lead to rickets, easy fragile fracture, as well as deformity of the bone. In old people, they will have osteomalacia. They will be fragile bone and easy to fracture. Also, this just skeletal, but also they will be prone for other diseases, which is extraskeletal health affected.
So almost you mentioned that vitamin D deficiency lead to skeletal and extraskeletal symptoms, everything, headache, bone pain, muscle pain. So sometimes it's confusing, you know, if you have this, you know, the pain is attributed to vitamin D deficiency or to something else.
In general, people, if they are vitamin D deficient, first of all, people, they will have like, they will be at risk factor. Whose are the risk factor? People who don't expose to the sun for a long period of time, those who are indoor for most of their time, obese people will be a risk. Also, black people will be a risk because the skin synthesis of vitamin D will be diminished. Old people, elderly, also people with infant with just only exclusively breastfed infant, they will be also deficient. Also people with renal impairment or liver impairment, some drugs like steroid, phenytoin, etc., those also will be at risk. And people with vegetarian or malabsorption syndrome, those also will be at risk of vitamin D deficiency. In general, the lower the vitamin D, most of people, they will feel symptom. And if the people just only borderline or in the insufficient stage, probably they don't feel that symptom. But in general, people with severe low or severe vitamin D deficiency, most of them, they will have symptom.
Excellent and very stunning, Dr. Naji. Now, what's the magnitude of vitamin D deficiency? How common locally and globally? Okay.
In general, vitamin D in general, it is very common. Vitamin D deficiency is very common. In Saudi Arabia, although it is a sunny area, we did a study with our colleague, Dr. Juhani and Dr. Malki, and we found that the best time, actually the only time for vitamin D, to get vitamin D in sun exposure is in the winter from 9 till 3. And from the sun start from 8 till 4. This is against what people think, that it is early morning or late afternoon. And now, although we have a good ultraviolet B from the sun the whole year, people, they don't expose even 10-15 minutes to the sun as exposure for the sun. And several studies show that vitamin D is very common. The lowest probably 51%, the highest 94%, approaching 100%. But Dr. Dagri from King Saud University did the meta-analysis and showed that 81% from all of this study, 81% vitamin D deficiency among people. And now this will be common in people who are old, in also people with comorbid illness, in people with osteoporosis, with comorbid illness, they will be more prone to have vitamin D deficiency. In general, sun exposure is fair enough if people, they will consciously expose to the sun in daily basis. If not, just like supplement, like as we mentioned, probably 1,000 daily. This will prevent people from vitamin D deficiency.
Dr. Naji, this is locally. What about globally? Are we comparing to global, you know?
Yeah. In general, in the Middle East, it is almost the same, like 80 plus or 81%. And in Africa, probably about 50%. In Europe, especially in Northern Europe, you will find it even low. Now, they have supplementation. For example, in the state, since 1936, they will have this vitamin D fortification in bread.
Excellent.
In 1952 in UK, they put it almost in everything, like they put it in juice and milk, etc. Amazing that, for example, Canada is a cold country. They don't have good sun exposure or do good ultraviolet B during the year, probably 4 months for most of the state. But vitamin D average in Canada is 67 nanomole, which is almost in insufficient stage. Compared to Saudi Arabia, we have 29 nanomole, which is in deficient stage. So, although they are less or less ultraviolet B during the year, but they have even higher compared to our due to food fortification of vitamin D.
Yeah, that's why you have done, or you have conducted a lot of research to resolve this mystery, why we have more vitamin D deficiency, and your conclusion that's we have inappropriate or improper sun exposure, and we don't have fortification of our food.
Yeah, in fortification in our food is just limited.
Limited.
Although it is stated 400 per liter for milk, but this is not mandatory. And if we go for our market here, probably less than 20% they have fortification of vitamin D. Milk itself does not contain vitamin unless you add vitamin D to it. It contains calcium, but just little of vitamin D. Other food sources, people, they don't consume, like fish or tuna or mushroom. It is not and eggs. Eggs actually contain vitamin D, but it's little. Probably liver also contain a little vitamin D. So not a good variety of food that contain vitamin D. So fortification or add-on for vitamin D is a good strategy to prevent vitamin D deficiency.
Excellent, Dr. Naji. Now we are coming to diagnostic method. Let's say that is vitamin D testing is one of the routine investigation, like complete blood count, liver function, renal function, because nowadays we have overwhelming number of tests for vitamin D. So when do we need to test patient for vitamin D or persons?
Okay. Vitamin D testing is not a routine.
Sure.
People
Excellent.
who are at risk factor, like people with fracture, osteoporosis, osteomalacia, symptomatic, they probably deserve vitamin D testing. But in general, it is not routine. However, people to have preventive method, this is a routine, like sun exposure for all. If you don't expose, take vitamin D as we described. This is for all. This is number one. Number two, vitamin D testing, in general, as diagnostic cutoff, if it is less than 50 nanomole, this is we consider deficient. If it is from 50 to 75, this is what we call it insufficient. Above 75, this is what we call it optimal or good level of vitamin D.
So, so you don't recommend that to consider it one of the routine labs?
No, it is not necessary. Actually, it is costly. And
very good. What's the cost average?
It depends from lab to lab, but in general, it costs more than 200 riyal.
200 riyal. Okay, Dr. Naji, that's important. Let's suppose a patient who has done is asymptomatic without symptoms and done vitamin D level and came to be you mentioned deficient, okay, less than 50. Do we need to treat? Is there any indications or guideline to start or initiate treatment?
So in treatment, there is 3 steps of treatment.
Excellent.
Number one, people, they need to know where are they. If they are at risk, they can check their vitamin D level. If it is low, they need to be replaced. This is number one. Number two, what is the cut? What is the level? If the level in deficient area, they need replacement, like loading dose, like you fill the tank. If it is in optimal or suboptimal level, probably they need just like maintenance therapy. Number three, after the treatment or after loading the dose of vitamin D, they need to maintain. There is several options to maintain their level, because if they keep the same after a few weeks, probably a few months, they will be deficient again, and they will enter this dilemma. So what they need to do, number one, the best thing to change their life, they need to expose thoroughly to the sun 10-15 minutes daily. And taking this, like for example, 1 cup of milk or 2 cups of milk daily. I did a study in Saudi Arabia, published 2013. Women who drink milk daily, 1 cup daily, they have higher vitamin D, 50% compared to those who drink less than often. And this is for vitamin D, sun exposure and drinking milk.
1 cup, huh?
1 cup daily minimum.
Sure.
Or yogurt, etc. Or they can take supplement, like for example, for adult people, they can take 1,000 to 1,500 international daily, or they can take it weekly or monthly as preventive method. If they do this, probably they will be in the safe side and they will have vitamin D sufficient all over.
Yeah, because I receive this question often times, a patient or who's asymptomatic young athlete and coming with vitamin deficiency, or so do I need to start immediately like a knee-jerk reflex treatment, or should I just risk stratify the patient?
If the level is low, the level is very sensitive. If the level is low, they need to be replaced. If the level is low, they need to be replaced.
Sure.
If the level is like in suboptimal or optimal, probably just maintenance dose.
Regardless of symptoms, okay?
Regardless of symptom. Actually, symptoms depend on the duration of vitamin D, the acute episode of vitamin D deficiency. Not all of them, they feel symptom. Some of them, even they mention that they don't feel symptom, but when they replace vitamin D, they feel different. Actually, I wrote a book called D, the Magic Vitamin in Arabic.
This is
and
the one?
this is actually a word of mouth of one of my patients. When I give them vitamin D, they said this is like a magic vitamin. I feel different. I feel something better. And in general, people who are having low vitamin D, they will benefit more for metabolic as well as symptom. People who are suboptimal or insufficient category and they get replacement, probably they didn't see any difference.
Excellent, Dr. Naji. So everything is, so this is the book of Dr. Naji he was talking about. The book, it's in English. What's
in Arabic, this is D, the magic vitamin.
D magic, like it's elixir of life, vitamin. Okay, that's the theme of our episode.
This is probably when I check for all the books, this is the first book in vitamin D in Arabic. There is plenty of books in English, but as educational in Arabic, probably I found chapter, but not a book about vitamin D.
Excellent. That's really a great effort from you, Dr. Naji. And this is the education and spreading awareness of the public about vitamin D. Vitamin D should be in fine balance. What about excess? Is it good? Because sometimes we say everything in excess is good. But in vitamin D, excessive vitamin D or more than required is good or bad?
The interesting, if people are exposed to the sun, whatever they expose, even the whole day, they will not get excess. The reason is that in our skin, will be anything excess will be not synthesized to vitamin D. So people who have even prolonged exposure to the sun, they can synthesize up to 20,000 per day, but no toxicity due to by the sun.
So safety valve there is okay.
For food, the same. Probably 1 cup of milk, it contains probably 100 international units daily. So even if you drink, you need to drink probably to get 1,000 daily, probably 8 to 10 cups. So from food, again, it is not an issue. The issue came from vitamin D supplement. It is not from 1,000 or 400 or 800 or 2,000. It is mainly from mega dose or large doses. Now, we did a review with Dr. Shahrani about vitamin D toxicity, and upon reviewing of all the literature, we found that people who get more than or 10,000 and above, 10,000 daily for 6 months, then they will get toxicity. They also get toxicity if they took 50,000 daily for longer period of time. So it is prescribed medication. But less than that, if they took 1,000 or 2,000 international daily, unlikely to get any toxicity.
So the 10,000 for
at least 6 months they will get toxicity.
6 months for long period. Okay. So what are the symptoms of vitamin D excess?
So if the patient having excess of vitamin D in general, we recommend not to exceed 250 nanomole. If they exceed 375, this is almost toxic of a level of vitamin D. They will have hypercalcemia and the symptom of hypercalcemia. Symptoms of hypercalcemia include polyuria, polydipsia. They will pee a lot, they drink a lot, they feel cramps, abdominal pain, headache, etc. And the long-run consequences include renal stone, nephrocalcinosis, etc. So what they need to do, they need to be hydrated, drink a lot of water. Probably if they came in the emergency, they will receive a lot of fluid, and stop vitamin D. Vitamin D, because it is fat soluble, to probably sustain a bit while, but in general, their treatment just only to stop their vitamin D. They will return to normal after hydration.
After how many days?
Usually, in general, if it is mild, just in the same day or second day, they will have normal calcium level.
Okay, thank you, Dr. Naji. Now we'll go for a report about understanding vitamin D. To watch more details about this report, stay with us. Don't go away.
Vitamin D is an essential steroid hormone needed for normal calcium and phosphorus homeostasis, as well as proper development and maintenance of bone. Clinical manifestations of active vitamin D deficiency, including the development of secondary hyperparathyroidism in patients with chronic kidney disease, CKD, are well recognized. However, there is so much more to learn about the metabolism, mechanism of action, and physiologic functions of this essential hormone throughout the body. Vitamin D can be obtained from various sources, including diet and exposure to ultraviolet sunlight. However, vitamin D from these sources is not biologically active and cannot achieve full hormonal function until it is activated by the body. Metabolic activation consists of adding two separate hydroxyl groups, one at the carbon 25, which occurs through the liver, and the other at the carbon 1, which occurs through the kidneys. The final result is the most biologically active 1,25-dihydroxyvitamin D3. Any break in this activation process, such as inadequate oral intake, inadequate sunlight, liver disease, or kidney disease, can lead to active vitamin D deficiency. Patients with chronic kidney disease have a decreased ability to complete the final activation process, and as a result are at increased risk for active D deficiency. Let's take a look at what happens to vitamin D once activated by the kidneys. Active D is fairly unstable and can rapidly degrade without the protection or attachment to a protein-based carrier. These protein carriers primarily consist of the vitamin D binding protein, DBP, and vitamin D receptor, VDR, two proteins central to the metabolism and mechanism of action of active D. Vitamin D is primarily transported to its target tissues through the vitamin D binding protein. The affinity of active D to this binding protein is one of the many factors that influence its biological activity and half-life. Once at the target cell, active D must be released from the vitamin D binding protein. Current evidence suggests that it is the unbound fraction or free hormone that has accessibility to target cells. Free active D taken up by target cells is either rapidly metabolized or bound to vitamin D receptors. Upon binding with active D, the vitamin D receptor undergoes conformational changes that allow it to interact with several other transcriptional factors within the nucleus. In order to interact with transcriptional factors and affect gene transcription, the active D vitamin D receptor complex must interact with a retinoid X receptor to form a heterodimer that can then bind to selective or promoter sites of the target cell DNA. This new complex then recruits various co-activators and/or co-repressors that influence gene expression and alter cellular activity. This can include protein synthesis and secretion, cellular proliferation, and/or differentiation. What determines the overall cellular response is the cell type and location, the number or availability of vitamin D receptors, and the affinity of active D to these receptors.
Once again, welcome back to Elixir of Life. Our topic, vitamin D deficiency, and our distinguished guest, Dr. Naji Juhani, consultant endocrinology and thyroid oncology. Welcome back, Dr. Naji. Now, just we'll continue the same line of discussion. How do I get vitamin D? What are the sources of vitamin D?
Okay, vitamin D can be get from three sources. Number one, the main source is sun exposure. If we expose our skin, usually need bare skin. It is not above the clothes, just bare skin for just only 10% from our body, like mid arms and legs. Even you didn't need to expose the face to the directly to the sun. And the time threshold in time in Saudi Arabia is from 9 till 3 in the winter time, as well as in the summer start from 8 till 10, then from 2 to 4 p.m. 10-15 minutes will be enough to get vitamin D. Yes.
Okay.
If a person who have dark skin or probably obese, they need probably more time. People who are busy, they can get half an hour 3 times a week will be also enough. This is the first source. The second source is food. Actually, not many food they contain vitamin D, but dairy product, milk, yogurt, fortified with vitamin D is good source, as well as mushroom, fish like salmon, sardine, tuna, egg, as well as some juices which is fortified with vitamin D, and also liver. The third source, which is the main one, is supplement. And usually we have vitamin D in oral pill, we have it also vitamin D in syrup, we have vitamin D injection, we have different forms of vitamin D. And as supplement, we have two types of vitamin D. We have ergocalciferol, which is what we call it plant vitamin D. It is actually manufactured from plant, like from mushroom. And we have also cholecalciferol. Cholecalciferol, they call it like sometimes animal or natural, etc. But vitamin D, cholecalciferol is slightly better among over vitamin D2. And vitamin D3, this is the one who's synthesized from our skin. Both of them is good for replacement, for maintenance, but if you have longer period of time, like if you want to give once a month or etc., we need vitamin D3 rather than the D2, the longer half-life of D3 over vitamin D2. So these are the sources of vitamin D.
Excellent. How long till the vitamin D supplement make me feel better or make the patient feel better?
Okay. First of all, it depends on the initial symptom of the patient and also depends on the severity of vitamin D deficiency. In general, people who are severely deficient, if they took replacement within weeks, 2-3 weeks, they will feel better if they have the symptom. Some of them, they don't feel anything, especially if they have no symptom to start with, or if they are in the like higher vitamin D level. But in general, within weeks, they will feel, their level will be corrected and they will feel better.
Excellent. Dr. Naji, can you give us live, examples from your experience, patient who have vitamin D deficiency and osteomalacia or paralysis, and you start treatment? What you have, okay?
Yeah, we have several cases. Actually, some of them I wrote in the book. Now, we see so many patients with vitamin D, especially with the severe vitamin D deficiency. Some of them even leading to easy or fragile fracture, like they hit the door, etc. They will have fracture, and when we test them, their vitamin D is very low, and in their bone they will show that osteomalacia. When we replace their vitamin D with also calcium, they will have like a stronger bone compared to the previous one. Also, we have people who having like weakness, especially in kids, like weakness that they cannot even manipulate or they cannot move. And like myopathy, severe myopathy due to vitamin D deficiency. I report several cases with vitamin D, even with autoimmune disease like Graves' disease. So vitamin D, especially people who are, the more the severe, the more the benefit from vitamin D supplement. We want all people to be sufficient vitamin D from even not from day one of life, but even in utero, like for pregnant mothers, they need vitamin D. I remember at one point they called for patient, a woman 6 months pregnant, and she has fragile fracture of her femur, and this is due to severe osteomalacia due to vitamin D deficiency. So it is a common problem for among men and women as well, old and younger people. Although we expect younger people to have good vitamin D, one study done by Dr. Lalwan and his colleague, and it found that even among school, intermediate and tertiary school, secondary school, they have vitamin D deficiency up to 94%, which is extremely high.
So, but after initiation of vitamin D replacement, you've seen the effect, as you mentioned, within 1 to 2 weeks, like a magic, a patient.
Yeah, if the patient have severe symptom and severe vitamin D deficiency, if they are replaced, they will feel
like better. Weakness, somebody weak, crippled,
their activity will be improved. Actually, even there is vitamin D effect on muscles itself, as muscle function, as well as muscle mass.
Very, very interesting. Now, leading us, what's the relationship, because we have discussed that, what's the relationship between vitamin D and bone, vitamin D and calcium and phosphorus, okay?
So, what's the function of vitamin D? The vitamin D have multiple functions, but the main function of vitamin D is absorption from the gut of calcium and phosphorus.
Excellent.
And calcium absorption from the gut decrease as little as 10% if the patient have vitamin D deficiency, and improve 50 to 60% if the patient have optimal vitamin D. Now, if the patient have vitamin D deficiency, in general, they will have vitamin D, calcium and phosphorus low, especially in severe vitamin D deficiency. Calcium is mineral number 1 in our body. It constitutes about probably 1 kilogram.
1 kilogram.
1 kilogram for adult people is only calcium. It is 99% in the bone, but less than 1% will be free calcium as neurotransmitter. So if the patient having low vitamin D, this will lead to hypocalcemia or decreased calcium. In general, even when we see the calcium is normal, this is due to the parathyroid effect. The parathyroid will take this calcium from the bone and keep it in the circulation to keep the calcium in the normal level. But this lead to demineralization of the bone as well.
Okay, so you mentioned that one, the calcium and phosphorus important for mineralization.
For the bone. And in general, people who having like severe osteomalacia or even osteoporosis, they will have like fracture in the mainly in the vertebra as well as in the femur. People who having like rickets, for example, they will have bowing of the bone, especially of the tibia, and they will have deformity as well as in the ribs as well as in the wrist. People, they need, especially in initial treatment, they need vitamin D as well as calcium. They need calcium for adult at least 1,000 milligram per day. In general, what we give them probably 500-600 plus the other should be contained from the food. Food contain calcium, mainly dairy product, egg and leafy vegetable. These contain calcium, but in general, milk, yogurt, dairy product contain a good amount of calcium.
So, Dr. Naji, so we need to take vitamin D along with the calcium, or take calcium with the vitamin D, and the recommended, you mentioned 1,000
daily. For people who having severe vitamin D deficiency replacement in the initial stage, they need calcium. People who are having hypocalcemia, they need calcium. People who have osteoporosis, they need calcium. People who are having low bone density, they need calcium. People like old people, men or women, or those at risk of osteoporosis, they need calcium with vitamin D.
Oh, great. So not all patients
they will take. If the patient have like vitamin D suboptimal or optimal, probably just they need vitamin D, but not necessarily to have calcium.
Yeah, excellent. That's a very important point you clarified. Now, what are the causes of vitamin D deficiency?
Okay, vitamin D, if we go like 30 years ago, people, in our life, they have changed their life before they exposed to the sun, and this is why we have like a bit brown skin color in the Arabic Peninsula. Now people, they don't expose much to the sun. They live probably indoor. They live most of the time indoor, so this is no exposure to the sun. Long sleeve also prevent our skin from synthesis of vitamin D. And not only exposure of the sun, but we need to expose to the sun with heat. If you feel that, if you stay in the sun, for example, 10-15 minutes, and you feel that there is also heat, this is a necessity to convert 7-dehydrocholesterol to vitamin D. The second cause is nutrition. People now, they like use junk foods, fast food, etc., and maybe soft drink, etc., but less milk product and dairy product as it should be. The third thing, obesity. People who are obese, they will have trap of their vitamin D in the fat cells, and they have less vitamin D. If they do exercise and lose their weight, vitamin D will be improved. The fourth thing, people who are elderly, the ability to convert by the sun to 7-dehydrocholesterol to pre-vitamin D is limited, especially if they are above age of 60. Number 5, people who have like dark skin. People, dark skin or like African color, they will have, because of melatonin, they will have almost natural sun protection, so about probably 15 factor. So this, it will prevent them. They need probably time more to get vitamin D. Also people who have, because there is 2 hydroxylation of vitamin D, one in the liver and one in the kidney, impairment of any organ like liver or kidney, it will lead to vitamin D deficiency. Medications, some of these medications, steroid and phenytoin and antiepileptic, will lead also to vitamin D deficiency. So these the main, like nutrition, vegetarian, people, they don't like, or malabsorption, celiac disease, ulcerative colitis, Crohn's disease, they are also prone for vitamin D deficiency.
Oh, very, very, very interesting. And now we are coming to what are the vitamin D skeletal and extraskeletal, health benefit.
So vitamin D is essential for bone health. Now, since childhood or since birth till age of 30, our body forms the bone. We will get the peak. We need good nutrition, exercise, healthy lifestyle, plus calcium and vitamin D. from 30 till 50 probably will reach a plateau. Then there is decline. Those with good vitamin D level and calcium and other factors, they will have maintained good bone health. But if the patient does not reach the plateau, they will have low bone density, and they are prone to more even risk for bone osteoporosis. Now, if the patient having vitamin D deficiency, they will in young children they will have softening of the bone and rickets. And rickets, a disease before they call it a disease of English disease. Now it is almost common everywhere. We assume that we eradicate rickets, but still here in Saudi Arabia we have several cases even on a weekly basis of rickets in Saudi Arabia. So this is for vitamin D in the children. In the adult, they will have osteomalacia, which is again decreased bone density and can be replaced by vitamin D and calcium. Osteoporosis, one of among them. Secondary osteoporosis can be, one of the causes is vitamin D deficiency, and as well as calcium deficiency. So these are the skeletal health. Also, vitamin D is good for muscle health. Now, sarcopenia, which is decreased muscle mass, with people with vitamin D deficiency is more common. For other like autoimmune, for example, it play a part in immunoregulatory or immunomodulator. And for example, there is several diseases that can be affected by severe vitamin D deficiency, and there is link between them. One among them is multiple sclerosis. Multiple sclerosis is very common as geography in Scandinavian countries, with vitamin D deficiency common there. But again, vitamin D and multiple sclerosis, there is several studies show that there is a strong link between both of them. Also metabolic. Although some of these studies does not show benefit if you supplement vitamin D with people with diabetes, but in other parts, this is in US, but other part of the world and published in diabetes care. For example, in India, if you supplement them with vitamin D, their blood sugar is improved. In our study, in our research lab with King Saud University, Prince Mehmet bin Abdulaziz Chair for Osteoporosis, we did several studies, and we show that vitamin D is good for insulin resistance. Actually, it will improve insulin sensitivity among people with vitamin D deficiency. So there is several part of cardiovascular for metabolic, immunomodulatory, as well as cardiovascular, because
cardiovascular, can you shed more light on cardiovascular?
People with secondary hyperpara, they are, if you increase the parathyroid hormone, again, it will put people at risk of hypertension, etc., as well as angiotensin-renin system activation. So vitamin D to be optimal is good. People with rickets, they are more prone for heart disease compared to those, and vitamin D deficiency more prone to have heart disease compared to those with optimal heart disease. So vitamin D is a good element, a main cornerstone of treatment for good skeletal as well as extraskeletal health.
What about the CNS? Because commonly patients attribute headache to vitamin D deficiency. Do you think that headache is related?
In general, vitamin D deficiency can lead to chronic headache, especially lower back ache and headache. And one of the studies published last month that showed that people who having good vitamin D, their headache decreased by almost more than 30%. Now, people like, for example, diabetes and peripheral neuropathy, this is like a pain in the legs due to impairment of nerves due to prolonged diabetes. One of the studies showed that when we supplement them with good vitamin D, their peripheral neuropathy the pain improve up to 50%. So vitamin D play a role, especially if the patient is sufficient, probably the risk will be less than people with deficient vitamin D.
Very stunning. What about loss of energy, fatigue? Okay, is it related to vitamin D deficiency? Because this is one of the common questions been asked. I feel fatigue, I don't have energy. After replacement deficiency, I feel more energetic, active, and mood is better. So
energy, there is multiple factors. Like one of them, like for example, hemoglobin, one of them thyroid, etc. But vitamin D or replacement for people who are severely deficient, they will feel good stamina and good energy. Now, if the patient have severe vitamin D deficiency, they will have muscle ache. They are prone even to hypocalcemia and seizure. They will have like backache, legs pain, as well as chronic headache. Sometimes they are disturbed sleep. So all of these together will lead them if you replace or alleviate these symptoms, lead them to feel better.
Mm-hmm. That's very interesting, Dr. Naji. Now, I think because you have mentioned very important that exercise improve vitamin
Yes.
D and prevent vitamin deficiency. And in the meantime, you mentioned that obese patient, they have more vitamin D deficiency.
Yes.
And again, they have less osteoporosis, obese. So just to, clear this information, this contradiction,
yeah,
okay?
People, if the person exercise, even indoor, their vitamin D will improve.
Is there any magnitude of or prescription for exercise?
What we advise, at least half an hour daily of exercise. So
Sure.
this will improve their vitamin D level.
Excellent.
Even when we did the study, it showed that improving lifestyle, especially exercise, it improved the vitamin D from 30 nanomole to 37 nanomole, which was statistically significant. And there is a lot of literature, even indoor exercise, this will improve. If you do it outside exercise, this is actually great. And for obese people, in general, obese, they have a good bone due to their good bulk of fat, but they are more prone for vitamin D deficiency. And even most of the recommendation from guidelines, they need even double, if not triple the dose of vitamin D. So if the person, they take 1,000, obese people, they need probably 2,000 or more. And even when they need replacement, they need it probably for a prolonged period. They need more vitamin D. If they lose weight, their vitamin D will improve and their requirement will be less compared to those people with obese.
Mm-hmm. So that's a very important point you have. Actually, we have covered most of the, topics related to vitamin D deficiency. And before we conclude, we'd like to get the take-home message from you, Dr. Naji. Give us the take-home message for this very important topic.
Okay. Vitamin D deficiency is a common disease. What I advise all people to have time to expose to the sun, physically active, stay awake, and if you don't have, you can take your supplement. I advise supplement for kids, 400 to 600 international unit daily, and for adult 1,000 daily for all. Thank you.
Thank you, Dr. Naji Juhani, consultant endocrinology and thyroid oncology. You have enriched the topic. There was wealth and the breadth of information about vitamin D. I think after anybody watching this episode will have clear, image about vitamin D and the importance of this vitamin. In fact, as you have stated, it's a hormone, not vitamin. And after listening to you, I believe vitamin D is the new elixir of life. Thank you, Dr. Naji.
Okay, thanks.
Okay, now we'll go to the last segment of our episode. We'll talk about health benefit. To see more details in this report, stay with us. Once again, welcome back to Elixir of Life. Now we are coming to the end of our program. We wish you enjoyed watching our episode and found it informative, enlightening, and motivating. We have to thank our distinguished team, cameraman Salim Al-Uraibi, Ahmed Al-Qahtani, Light, Majid Al-Mathi, Diko, Rashid Al-Salim, prepared by Rahab Al-Khulaiti, presented by me, Dr. Mohammed AlSheef, and Assistant Director Firas Al-Kinani, and Director Abdullah Al-Wali'i. Until next week, we wish you a pleasant week ahead. Assalamu alaikum wa rahmatullahi wa barakatuh.